When you're navigating cancer treatment, it can feel like a full-time job, right? It's incredibly demanding. So, where do you find that structured, expert support that works with your primary care? Well, today we're going to look at one potential answer: Macon Metabolic Care. It's such a common feeling. You see your oncologist, they're laser focused on treating the cancer, as they should be, but then what about everything else? That time between appointments can feel like a total void, leaving you trying to figure out your metabolic health, nutrition, supplements, lab results, pretty much all on your own. And that feeling right there, it points to a really significant gap in care. Your standard oncology team is absolutely essential, but they just often don't have the bandwidth to give you a detailed, day-to-day roadmap for your overall metabolic well-being. And this creates some very real challenges. There's almost no structure. The advice you get on supplements can be confusing, sometimes even conflicting. You're not sure which labs you should even be tracking. And follow-up can feel, well, inconsistent. It leaves so many people feeling like they have to piece together this giant, complicated puzzle all by themselves. Okay, so this is exactly where Macon Metabolic Care, or MMC, steps in. Their whole goal is to be the solution with something they call the Cancer Metabolic Optimization Protocol, or CMOP for short. It's designed to bring back that missing structure and clarity. So how does it work? Well, it's a really clear 90-day program that's led by physicians. You start by joining and getting a baseline with labs. From there, you get a personalized plan and, this is key, consistent support to actually stay on track. The idea is to just remove all the guesswork. Now, here's what I think is the real game changer. It's how they make sure you can actually follow through with the plan. See, it's not just a document they hand you. It's a plan that comes with a dedicated human support system. They do this by partnering with a group called Heal Navigator. You can think of them as your personal clinical pit crew, a team of oncology-trained nurses and care coordinators who handle all the logistics so that you can focus on what really matters, your health. So what does this team actually do? They handle all the practical stuff for you, getting you onboarded, scheduling, managing your medical records, and constant follow-up. Got a question between doctor visits? Now there's a dedicated, knowledgeable person you can actually ask. This consistent support is all about getting rid of those logistical headaches. And you can really see the impact this has. Just listen to this from Rod, a patient at MMC. He said this support was key to managing his journey with so much more confidence. At the end of the day, it's about feeling cared for, not just treated. And ultimately, that's the whole point, isn't it? When you combine a structured medical plan with consistent nursing support, it's designed to give you three things: clarity on what to do next, confidence that you're making the right decisions, and a much greater sense of control over your own health. Their whole approach is built on this idea of hope through action. The thinking is that real confidence doesn't just appear. It comes from having a clear plan and the dedicated support you need to actually put that plan into action. It's a pretty powerful model because it really flips a script from just passively receiving treatment to actively participating in your own care. And it leaves you with a big question: what could a system like this really change for patients everywhere?